We welcome you to CBS This Morning on this Monday.
Yeah, and we begin with troubling signs about America's progress against the coronavirus as COVID infection rates surge now in every state. Experts say the upward trend is being fueled by the Delta variant and by unvaccinated Americans. As of last week, more than 97% of people admitted to the hospital for COVID had not gotten the vaccine.
Oh boy, and the new projections show that COVID cases nationwide will likely continue to rise over the next few months, peaking in mid-October. Daily deaths could more than triple from current levels, rising back up to around 850 a day. Our lead national correspondent, David Begnaud, is in Jackson, Mississippi, the state with the lowest vaccination rate in the country. David, these numbers are so scary. Now, I know you visited St. Dominic-Jackson Memorial Hospital. What did you learn there?
Gayle, it's like deja vu all over again. They just canceled all visitation for COVID patients, and they've gone back to those FaceTime visits. Let me set the scene for you. The first week of May here at St. Dominic's, they had 2 COVID patients. The first week of June, they had 5. First week of July, they had 10. They've got 59 this morning, and they're looking at extra wings of the hospital to try and find space to house these people. Here are some of their stories.
This is William Ball. Alicia is his wife.
How badly has COVID ravaged his body?
Extremely bad.
He is 52, no longer infectious, but he's too sick to go home. He had a heart attack at the end of June and then contracted COVID 9 days later.
There will be people who watch this who don't think the virus is serious.
We didn't either at first. I'm not gonna lie. We had no idea.
She got vaccinated. He didn't. They both got sick, but only he wound up like this. Vicki McKnight is 64. She says her doctor told her not to get the COVID vaccine because she's allergic to the flu vaccine. She says a second doctor told her you need to get the vaccine. But before she could, she says she contracted COVID at a funeral.
Your husband got the vaccine.
Yes.
And your husband also got COVID.
Yes.
But did he end up in the hospital?
No.
Edward Clifton is 38. When he showed up sick with COVID at the hospital, he didn't even know that he had underlying conditions, kidney failure and diabetes. He too is unvaccinated.
Well, I want to tell everybody, please take the shot.
This virus is no joke. If you want to feel really, really horrible, this is a great way to do it. Trust me.
45-year-old Larry Smoke is also a diabetic, and he had a heart attack 4 years ago. He says a week after he got his first Pfizer shot, he started showing symptoms for COVID-19.
Even people that got both doses, if they have underlying conditions, we don't know if they got a full antibody response. So their immune system may be weakened. So it's making us even come back and question, should we be giving booster doses now to those with underlying medical conditions?
Back in William Ball's room, a doctor was called to determine if William was having another heart attack. His wife spoke for him.
He will get the vaccine when he gets out of the hospital.
When he said, I want that vaccine, tell me what you're thinking.
He's got to get out of the hospital first.
Within the last week, we've let you hear from COVID patients in Arkansas, Louisiana, and now Mississippi. And I often hear from folks on social media who say, David, I don't want them forcing the vaccine on me. Just give me the facts. So here are the facts for Mississippi. 89% of people hospitalized here are unvaccinated. 91% of COVID patients who've died in Mississippi are unvaccinated. Those are the facts. Gayle?
And those are the facts we need to hear over and over and over again. David, thank you very much.